Hello everyone and welcome to my channel. My name is Maria and on my channel I create videos around nursing and I also have a handful of lifestyle content. I am trying to get to 10k subscribers, so I'd really appreciate it if you subscribe to my channel and also if you gave this video a like. Not only does it tell YouTube and help the algorithm out by telling them that you would like to see more videos like this, it also helps with the growth of my channel. As usual, this video is in partnership with www.nursingpersonalstatement.co.uk, so make sure you check that website out if you haven't done so already. In this video, I'm going to be sharing some of the crazy things that have changed at the hospital since this coronavirus pandemic has started. And the reason why I say that they are crazy is because if 3-4 years ago you would have told me that I have to do all of this stuff now, or that all of these changes are going to happen in the hospital from 2020 onwards, I would have been like, why are you lying? But to think that a lot of these things are actually a reality, it's kind of mind-blowing actually. When I think back and think about what I was doing as a nurse, even just like a year and a half ago, in comparison to what it is that, you know, I'm doing as a nurse now and how the working environment has changed, it's actually quite crazy. It's actually quite mind-blowing. Initially, I was thinking that I would only share 3, but as I was writing the list, like, it just kept going and going and going and going. I do want to, you know, quickly say that things are changing all the time. Some of the things that I have mentioned in the video, they may change tomorrow. Like, I literally got an email at work talking about one of the things that I'm going to mention, and I'll explain it as the video goes on. But take everything that I'm saying with a grain of salt in terms of the fact that a lot of this will probably change in the future, and it may not be the same in the nursing environment or in the healthcare environment that you're working in. Obviously, it's not like a one-size-fits-all policy, so don't think, oh, my hospital isn't doing that, or my GP isn't doing that, or my chemist isn't doing that. Best believe that there is, or I'm hoping that there is, a valid reason as to why they are or why they are not doing certain things. I feel like this video will just be beneficial for anyone, for student nurses who are kind of nervous about their first day of placement, for registered nurses who have been out of practice, or just for, you know, regular nurses like myself who literally just want to know what's changed. Got my laptop here because I wrote some of them down. So the first thing that I've noticed at my particular hospital is that we now have security at every single entrance, and they're checking your name badges before you can enter the hospital. Before, we never had security like that. At the main reception we would have porters, and then at the entrance at the back we never had any security. You just swipe your badge and just walked, you know, straight through. But now at every entrance we have security. I know that that is simply down to the fact that we can't just have anyone and everyone into the hospital. The only time you can come into the hospital is if you're actually like a member of staff working there, or if you're a contractor and you actually have to do stuff in there. Gone are the days where, you know, someone could just come into the hospital, go into the restaurant, get something to eat and leave. So no, that has no longer happened. We have security at every single entrance, making sure that you've got your name badge, making sure that you're wearing your face mask, and also making sure that you're using hand sanitizer before you enter the building. Another thing that I've noticed that has changed, and I don't think this is just limited to my hospital, I think it's with every hospital, every healthcare facility, everywhere, every building you go to, you have to wear a face mask. You cannot enter the building if you don't have a face mask. And when I'm talking about face masks, I've got one in my bag, I mean like a simple face mask. So one thing that I do want to say is that if you have a face mask upon entrance into the building, you have to dispose of the face mask that you're currently wearing, and you have to wear a completely new one. So don't think that, oh, I've got a face mask in my bag, I can just pop that on and walk straight through. No, you have to dispose of the one that you're already wearing, and then you have to wear a completely brand new face mask. And obviously, depending on what part of the hospital that you're working with, a simple face mask will not suffice. If you're just in a restaurant, if you're just walking down a corridor, then a simple face mask will work. However, if you're working with patients with suspected COVID, if you're working with patients who have confirmed COVID, then a face mask will not do. You will have to switch over. It depends what the PPE policy is, but you will have to switch over to an FFP3 face mask if you're working with patients who have suspected COVID. And then if you're working with patients who have confirmed COVID, or if they're doing aerosol generated procedures, then you do have the option of wearing one of these bigger face masks. I don't know what they're called. Luckily, I haven't been in a situation where I've had to wear one of these face masks, or where I've actually had to wear it in real life. But yeah, you always have to have a face mask on, and obviously you'll titrate the level of face mask up and down depending on, you know, obviously where you're working, what it is that you're doing, and all of that stuff. Make sure you check with your hospital or your healthcare facilities guidelines on what you should be wearing. The next thing that has changed at my hospital is that we now have zones. We have 3 zones. We have a green zone, which is completely safe. We 100% sure, well, you're never 100% sure, but we're close to 100% sure that the patient doesn't have COVID. And then we have the amber zone, which is suspected COVID. And then we have the red zone, which is this patient has confirmed COVID. However, as of, I believe, yesterday or the day before yesterday, I received an email saying that from now on, we will no longer have 3 zones. We won't have the green, the orange, and the red. We are only gonna, or the green, the amber, and the red. Amber or orange, I'm gonna use them interchangeably. I got an email saying that we will no longer have the 3 zones. We will only have 2 zones, which will be amber and red. And the reason for that is because sometimes there's been a couple of cases, I'm sure it's not just at my hospital, but at other hospitals as well, and at other healthcare facilities, where we have confirmed that the patient doesn't have COVID, and then they come into hospital, they're at hospital for like maybe, I don't know, 1, 2, 3, 4 days or weeks or months or whatever, and then down the line, when we're doing our regular COVID checks on them, we found out that actually before they didn't have COVID, but now they do have COVID. And obviously, if you're not checking them every day, you don't know how long that the patient has had COVID without you knowing. So yeah, rather than having the green zone, the orange zone, and the red zone, we just have the orange and the red. So even if a patient has had several COVID tests and they've all come back as negative, we still have to treat the patient. We still have to treat the patient as if they have suspected COVID, which I think is actually a very fantastic idea. Yeah, I think that's a great idea. It's a great step forward. I do want to kind of mention as well, at my hospital, before any patients can come in, whether they're being admitted from home or whether they're being transferred from another hospital, they have to have a COVID test that says they're negative. They can't come and say, oh, I had a COVID test, you know, 5 weeks ago saying I was negative. No, as far as I'm aware, it could change. Like I said, everything is changing, but the COVID test that they have has to be, the last COVID test that is negative has, how am I saying this? The COVID test has to be negative and it has to have been within 72 hours. And if the patient is being admitted from home, so if they're coming from home straight into the hospital, they have to confirm that they have been shielding or isolating for at least 2 weeks. So even if they've had a negative COVID result, you know, yesterday, but then they've said, you know, they've been Tesco's, they've been to their aunt's house, they've been to the cousin's house, they haven't been following any guidelines, then we will not admit them into the hospital. Same with if a patient's being transferred from another hospital, we have to confirm with the other hospital that they have had a negative COVID swab in the past 3 days. And as soon as the patient comes into the hospital, first thing is, hello, my name is Maria, I have to do a COVID swab on you ASAP. We do that COVID swab straight away, send it straight away to the lab, and then we can get the results back from the lab, confirming that the patient is still COVID negative or if they're COVID positive. And then, so they have a COVID swab before they come into the hospital. They'll have a COVID swab as soon as they get, before I offer you a cup of water, best believe I've already done a COVID swab. Best believe we've already done a COVID swab on you. And then we also do a COVID swab on day 3 of admission. So the day you're admitted counts as day 0. No. The day you're admitted counts as day 1. We also do a COVID swab on day 3. And then we do a COVID swab every 7 days. And then obviously, if in between that time you start coughing, you've got a temperature, then obviously we'll do a COVID swab, you know, more often. Those are just guidelines. You use, you know, your practice to kind of decide how often you should do it. If my patient had a COVID swab yesterday on day 3 of their admission and the next COVID swab isn't due for 7 days, if they've got a high temperature, if they're coughing, if they just say they just, you know, generally feel unwell, then I will do another, or not just me, but me or anybody else will do another COVID swab. Another thing that has changed, that has been the bane of my existence, is maintaining a 2-meter distance at hospital. Like, anybody who works in a hospital, like anyone who works in a hospital knows that it's literally impossible. Almost impossible. No, it is impossible to maintain a 2 meter distance 100% of the time. Like, it's actually not possible. Yes, we try our best, especially when it comes to, like, you know, having your breaks, having your lunches and stuff like that, but it is impossible to maintain a 2 meter distance 100% of the time at the hospital. But there are measures in place that will help us. For example, rooms that weren't previously opened for staff to have their breaks are now opened. Obviously, because we're not having any visitors, where we would originally have visitors, all of those rooms have now been opened up as staff rooms, as break rooms, meaning that there are less people, you know, in the restaurant downstairs, and, you know, kind of people are spread around. So there are measures in place to kind of help us to, you know, maintain a 2 meter distance, but it's not possible. How do you take someone's blood pressure and maintain a 2 meter distance? How do you take bloods and maintain a 2 meter distance? How do you assist someone with a wash? How do you give someone their medication and maintain a 2 meter distance? So I hope you guys understand what I mean about it is literally impossible to always maintain a 2 meter distance, but there are things that we can, you know, put in place to kind of help us to achieve that. Another thing that has changed at our hospital, and I'm sure it's changed at your hospital, is that we have a strict policy of no visitors. Absolutely no visitors at all, you know, no visitors at all. Obviously, it's not a one size fits all. There are situations where we have allowed people into the hospital. However, you don't just come in as a visitor. Right now, we're treating you as a patient. So say, for example, if there's, like, I don't know, a 15-year-old child, or if there's like a 30-year-old person or whatever, and a visitor wants to come in, the visitor has to have a COVID swab, the same as a patient, within the past 72 hours. They have a COVID swab when they're in a hospital, and they have to stay in the hospital for the duration of this stay. Before, if a visitor came, they could come, go to WH Smith downstairs, see the patient, leave for a fag break for 2 hours, come back, you know, go home, come back, you know, the next week. Now you can't do that. If you're a visitor, you have to come in and you legit have to stay. The moment you leave the hospital, you cannot come back in. Another thing that's changed is that rather than having 6 beds per bay, we only have 4 beds per bay, and that is obviously to help maintain the 2 meter distance. And now when I go into the bays and I only see 4 bays, I'm like, how on earth did we ever manage with literally 6 patients in a bay? Like, how did we manage with 6 patients in a bay? So now we only have 4 patients in a bay, and that's probably one of the first things that patients always comment on when they come into hospital. They're like, oh, there's not 6 beds in here, there's only 4. And I'm like, yeah, because, you know, we're trying to help everyone maintain a 2 meter distance. I also want to add as well, in terms of like bays only having 4 beds rather than 6 beds, that's at my hospital. At your hospital, maybe you may have had 4 beds and it's still 4 beds because you can still maintain a 2 meter distance. That is one of the reasons why hospital beds or hospital bed numbers have reduced dramatically at a handful of hospitals, because let's just say before, all their wards were all bays and all their bays all had 6 patients. Now, keeping government guidelines, they can literally only have a maximum of 4 patients per bay. So that's one of the reasons why hospital bed numbers at some hospitals, at some trusts, may have dropped dramatically. It's because we can't have 100% of the beds that we used to have. Another thing that's changed is that publicly funded patients and privately funded patients are now mixed. Before this whole COVID pandemic thing started, at my hospital, we had a ward that was strictly for private patients. And then, you know, every so often we would have, you know, a private patient in a side room on one of the wards that generally catered to publicly funded patients. But now, since the coronavirus, everything has mixed. The ward at my hospital that was originally for private patients, that just has like a mixture of privately and publicly funded patients. Everything is now mixed. It's I think it's just mixed just because, you know, before we could take 6 patients in a bay, now we can only take 4 patients in a bay. There's so many different reasons as to why it's all mixed, but it doesn't, honestly, it doesn't make a difference. From what I'm doing in terms of publicly and privately funded patients, it makes no difference whatsoever. The only thing that I can kind of notice, or that I noticed at the beginning, was that some of the catering staff may have had a bit of problems trying to find who was publicly and who was privately funded, because at my hospital, obviously privately funded patients, they're paying for their healthcare. What they got to eat was a bit different from what the publicly funded patients got to eat. So rather than the catering staff knowing that all the private patients were on X ward, now they're mixed everywhere. At first I had a bit of difficulty, but honestly for the most part, as long as they're getting food, I don't think they care if their food is organic, you know, picked by virgins on a full moon. I actually don't think they care. As long as they've got food after their procedure, then, you know, everyone is fine, and no one's really complained. No one has ever complained to me. One final thing that I want to share with you that has changed, that is like probably the most frustrating, well, it's not frustrating, but it's the most jarring thing that has changed, that I'm just like really is the fact that, oh guys, like if I could roll my eyes a million times over, I would do that. One thing that I've noticed that has changed since the COVID pandemic is that we can now wear Crocs. And when I say Crocs, this is what I mean. Crocs. These are not my work Crocs. I have 2 pairs. These are the Crocs that I wear at home, and then I have a pair of Crocs that just stay at work that I wear at work. We can now wear Crocs. Before the COVID pandemic, the only people that could wear Crocs were members of staff who worked in theatres, and I never understood the rationale for them. I never understood the rationale for that. I actually questioned someone about it, and they said it's because Crocs, some of the Crocs have holes in them, and if you drop a needle, it might, you know, go through the hole and, you know, stab you in the foot, which I can understand. But then I was like, but not all Crocs have holes in them, like these ones. Like, there are special types of Crocs for healthcare staff that have absolutely no holes in them. There is no reason. And the reason why I always preferred Crocs is, 1, because they are very, very comfortable, and 2, because they are so easy to clean. Literally at the start and the end of your shift, and several times during your shift, because I walk weird and my Crocs get messy very quickly, get some cleaner wipes and wipe it. With, you know, other pairs of nursing shoes, it is not as easy to clean the shoes. And honestly, from an infection control side, I feel like Crocs are the most hygienic footwear that you could wear. So I could never understand why some hospitals, not just the hospital that I'm at now, but other hospitals that I've been at, I could never understand why some hospitals said that you couldn't wear Crocs. You can only wear Crocs if you work in theatres. And I'm just like, not all Crocs have holes in them, and some Crocs, you know, they cover your ankles, so what's the reason for it? But since the pandemic, now we can wear Crocs. Why can we wear Crocs now? We can wear Crocs now because I really don't know why. We can wear Crocs now. There's no reason why. There's no reason that I can think of that's any different. You can clean your Crocs now just like you could clean them before, but I think it's because, you know, maybe people are more aware, and people are like, actually Crocs are really good because you can clean them. Like, you can clean them every second of your shift and it's no issue. So I think that's probably why we can wear Crocs now, to the point where at the start of the pandemic, my hospital, I don't know if it was my hospital or if it was like a charity or if it was just someone who had a lot of money, they literally, at one point, they were literally giving out Crocs for everyone to wear, not just theatre staff. So that's how I got my second pair of Crocs, because someone or an organisation was kind enough, thank you very much, was kind enough to, you know, donate, give, I'm not sure how they did it, but give us basically Crocs that we could wear. But another thing are scrubs. Before at my hospital, we had to wear our uniform. Obviously, unless you worked in theatres, then you would wear your scrubs, which I can understand why, if you're in theatres, you really should be wearing scrubs. Anyway, before you had to wear your uniform if you worked on the wards. However, in light of everything that's happening now, not that we all have to, but now we all have the option of wearing scrubs, which is great because it means that the last time I ironed my uniform has been months. It's great because I don't have to pack my uniform to work, and in my opinion as well, it is more hygienic. I go into work, pick a pair of scrubs, put them on, do what I need to do. When I go home, take my scrubs off, put them in a linen bin, come in for work the next shift, and I know there's going to be a clean pair of scrubs for me to wear. So that's another thing that has changed. So there we have it, just some of the things that have changed at my hospital since the COVID-19 pandemic. If anything else arises that I feel is worth mentioning, then I will do another video about, you know, X amount of things that have changed since the COVID-19 pandemic. Like I said, I am trying to get to 10k subscribers, so I'd really appreciate it if you subscribed to my channel and if you gave this video a like. Thank you guys so much for watching, and I'll see you guys in my next video. Bye!